All right, let's get to this. At 8:16, children's hospitals across the country are grappling with a nationwide surge in RSV infections.
Well, it's so scary, particularly when it comes to babies. It's an unusually and unseasonably early spike, and it's widespread across our area, pushing our children's hospitals to capacity. Dr. Jonathan Miller, who's the chief of primary care at Nemours Children's Health, is joining us. Thank you for joining us. We like your repping your Phillies pride as well. Good morning.
Good morning, Karen and Mike. Thanks for having me. Go Phils.
How do you know that your child has it?
So RSV is a respiratory syncytial virus, and in most people, RSV causes a common cold. So they'll have runny nose, congestion, cough, and that's how adults and older kids will experience it. But in infants and toddlers, it can lead to labored breathing, not feeling well, fevers, struggling to catch their breath, and sometimes not wanting to eat or drink, and that can be concerning for parents.
Well, that's really scary.
Sure.
What's the situation in our area? How are our hospitals poised right now? Are we seeing an influx of these cases?
We are seeing a lot of RSV as well as some other common respiratory viruses right now. In fact, it feels like we're in the middle of a bad winter season, and it's felt that way for a couple months now.
Is it because of COVID that we didn't have our kids like interacting and back at daycare and around so many other people that now we're seeing so many more cases and their immune systems aren't really primed?
Yeah, you know, I don't think we completely understand why it's happening, but certainly part of it is that the impact of the pandemic and some of the important measures we took to protect ourselves during the pandemic, like masking and distancing, have had the effect of changing the seasonality of viruses. And so typical viruses are coming when they wouldn't normally come. And so RSV, for instance, we saw a peak last summer, and we're seeing a peak again this summer into the fall. And usually this is a late fall and a winter virus. So it's really, it's abnormal.
Yeah, well, we certainly don't want our babies getting this. Is there any way to prevent it?
So it's spreading quickly right now, but the types of things that we recommended around the pandemic are the same types of things we recommend for common colds and spread of other viruses. So washing your hands, covering your cough, if you're sick, wearing a mask, and you know, doing the right thing when you're around other people, right? Sort of owning your symptoms, knowing that you're going to slime people if you get too close to them, and keeping a little bit of distance.
How do we treat it? Is it something, you know, when your kid's struggling to breathe, you just, you know, you don't know what to do. Do you get them in a shower? Do you take them to the hospital or have a nebulizer? What do we do?
So there's no antibiotic or antiviral medicine that specifically makes RSV get better quicker. And so, you know, we recommend trying to keep kids hydrated by giving them fluids. You can keep them comfortable with Tylenol, or if they're 6 months and older, you can give them ibuprofen for fevers or for comfort. But if you're seeing signs of labored breathing, if your child looks like they're struggling to breathe or they're working hard to breathe, I do recommend reaching out to your pediatrician to talk through those symptoms to see what else could be done.
I think I would put the mask back on if I'm flying on a plane. Something like that?
Yes. I think I'm seeing people that are doing that in certain areas.
All right.
Doctor, thank you. We really appreciate it.
Yeah, great job.